today's topic will be on FrontLiner, the or medical science. FrontLiners made in Segi itself. So we have a lot of very interesting speaker, field industrial workers. So they are working in the field already, operating in the operating rooms and also in scientific labs and so on and so forth. So if you're the students that really want to know what they are going into in the future, because you are doing foundation, so you want to know, hey, what's it like being a doctor, being in medical field, being in biomedical field, this kind of thing. This is the topic for you. Especially, I know a lot of students here want to know what's going on with the frontliners as well. This will give a little bit of a insight as to what's going on. So today's topic will be brought to you by Segi University. We have representative in our chat. So if you have any questions at all about the college, about whatever it is, just leave it in the chat and then we'll just discuss it along. We have two very special speakers today, Dr. Vichet and also Serene. I want to lend the stage to Dr. Vichet first. Dr. Vichet, welcome.
Okay, thank you, Marvin, and hi, everyone. Thank you for spending the time with me for this webinar. And today I would like to share a bit on how is actually frontliner and medicines is going on. Just to introduce myself, I'm Vichet, currently a house officer in Hospital Cebu, Sarawak. I actually completed my medical school around 2 years ago and started my training in Hospital Cebu on 2019 November. So as everyone know of in the news now that COVID actually hit very hard to Malaysia. So a lot of people having doubt that we are doctors, we also humans. Actually, how we're going to encounter this? Why people at outside they just dining together, then they actually get COVID, and any stigmata to us or not? As we the one actually go and treat those COVID patients, we are encounter a lot of COVID patients. So the answer is yes, we get a lot of stigma. I even bang out from the restaurant as because I wear my scrub that with the doctor name here. So it's very common. So for everyone know of, before you go and treat people, just learn how to protect ourselves. So same goes to any other field. So for your guys outside, just wear mask, show protector, take care of your hand hygiene, take care of your personal hygiene. If you know that that place is actually high risk of COVID, just don't go there. And for us, actually, it's our job, it's our responsibility to go and treat the patient. Even though some patients are known to have COVID or they come in for other reasons. For example, they're actually unfortunately involved in accidents, so they're actually having fracture over the leg. But because who knows that they actually got contact with the patient. So for us now, as our standard operation protocol, everyone before admit to hospital Cebu will at least screen them by using the COVID RTK, mean the fast screening you all know of in the newspaper. To those who need to go operation or definitely, or even those having some respiratory symptom, for example, when you go and meet the patient actually a bit of coughing, a bit of shortness of breath, or not comfortable, or he tell you that he actually not vaccinated, or even those he tell you that actually he's from somewhere who are actually under quarantine area, then all these patients we are considered as high risk. Then we will go and take COVID PCR for the patient and go to isolate them. Mean we keep to another side of the hospital to isolate them. And you're thinking that so you isolate them mean you not see the patient? The answer is no. We still go and see the patient, but wearing the full PPE. PPE mean personal protect equipment. So it's like what you see in newspaper, or if you see some movie like Ebola. So we wear like the the space suit. So we wearing face shield, N95, goggle, shoe, head cover, gown with glove, even double glove, shoe covers, and go to meet those patients. And this is not a very good experience for me lah, personally, because all those things actually is not what is waterproof, so it's hardly breathable. I mean, with those things actually a bit hard to breathe then, because I wearing my spec also. So every time you breathe, actually you have a mist on the face shield, very hard for you to see. But with those things, we still need to meet our patient, ask them the history, examine them, check their lung, check maybe if there is other problem, we check those things. Then we even take blood, do some treatment to them. So this is how current issue, but it's kind of like already a new norm to us. As everyone know, COVID actually is a very big issue. Don't think it will be go on so fast. So everyone also actually learn, try to adapt it, but our medical service doesn't stop like entertainment field, they can just shut down themselves. But we, everyone, even though you have COVID, with no COVID, you still get sick, and we still go and treat you. So just a base introduction to everyone, what is actually medical life with out of this COVID topic. So me myself actually is a house officer. So house officer basically mean I'm still a trainee doctor. So after you graduate from a medical school, you undergo 2 years of compulsory training in a particular hospital you can select yourself. So in these 2 years, you will go through 6 posting, which is medicine, the one you give medication, you treat those heart disease, MI. Surgical posting means you go in operation, see how the surgeon actually do appendectomy, how to remove things, or for example, there is trauma, orthopedic, how to fix the bone. And ONG mean to those who like kids, to like to handle mother, how to take care of pregnant mother, how to take care of newborn kids for the pediatrics. And last but not least, for myself, I'm actually in NS posting, mean in ICU, we take care of critical ill patient to induce what we mean in layman term, we make the patient sleep so that the surgeon can operate on them. So this is what basic about how was a house officer. This going to be a 2 years training. So this 2 year training, we still having multiple exam, we still having multiple assessment, training, logbook. For example, like just basically how what is the thing you have been done, all those things. Then after these 2 years, only you can be a fully registered doctor, which means you are fully trained, you are licensed to go out if you want to become a private GP or you want to continue serving government. And there is a time that you can proceed with your study. For example, say, yeah, I wish to become a neurosurgeon. So that after that 2 year training, only you continue. So just a bit sharing on myself. I actually want to join medicine for since I'm child because of my mom issue. My mom actually having myocardial infarction, basically heart attack. Then a doctor actually treat her very well until now. I still have my mom, so very thanks to my doctors. So since that time, I actually started to study hard. So for those who want to join med school, you actually need to go through your foundation, O level, which is SPM, or for those in private secondary school is O level. After that, going to your A level or what we call foundations. After that, if you hit your minimum requirements, which you can proceed with asking them, then you can join your 5 years of medical school. So this 5 year medical school is have different structures. For myself in Segi, we divide to 2 structures, which is preclinical for 2 years, mean we learn about all the basic, mean theory part. What I call you learn about how the human look like, what is this bone, what is this hand. So we medical people like to classify everything. So basically, for you, this is called hand, but for us, different bone, different finger, you call this as index finger, but for us, it's called second metacarpal, metaphalangeal joint, something like that. And physiology, how your body work. Pharmacology, the Panadol, what we usually get from the outside, what is actually content of, what is the side effect of that medication to our body. After that, we'll learn about pathology, mean, for example, structure of coronavirus. Then you will learn about how it actually look like, how it actually transport. All this basic knowledge to equip yourself preparing before you become a doctor. And after that, I'm actually sent to Cebu, Sarawak, which is a small town, for continue my clinical year. Clinical year mean after you have those knowledge, after your assessment exam, then you start to challenge yourself with the real patient, mean under the supervision of your lecturer and your doctors in the hospital. Then you try to start to what we call clucking case, mean you ask the history of the patient. For example, why you are here, what's going on to you, then try to examine them, use the stethoscope, go and auscultate, listen to their lung, listen to their heart, pick up any abnormality of them, learn how to take blood, learn how to read x-ray, learn how to read CT brain, understand what is a very famous thing now in the news, what is a pulse oximeter, how many percent is normal for normal human, how many percent is acceptable for old people, all those things. So these 3 years is never easy and it's quite tough. So if those, but however, if you are really passionate and want to become a doctor, I think all these things actually can be really easy to counter over it. So if you are ready and thinking of want to join medicine, no need to care, no need to so scared about COVID. I mean, you of course you need to protect yourself, but no need because of this COVID then aware yourself from joining medicine, because COVID actually now is a new norm, is anywhere. Uh, of course, if you join medicine, the risk is slightly higher. But before we let you all go to meet those patients, we actually teach you all how to protect yourself first. Still, that very beginning, during on my sharing, learn how to protect yourself first before you go and teach, go and help people, go and treat those patients. So if you are ready, welcome to join medicines.
Hmm. Uh, what we heard is that a lot of doctors or potential doctors or housemen are working through long hours and tirelessly. They just don't sleep when they work. Is that really true? And is that really something that students should be afraid of?
I don't think it's something need to afraid of. We in Malaysia we're currently using shift system. Mean we are doing like for example few hours to few hours. So we do divide to AM shift, mean a morning shift, a PM shift means slightly longer hour, and a night shift. So for AM shift, official hour actually status to be 7 to 5 o'clock, means 7 AM to 5 PM. For those PM shift is from 7 to 9 PM, and night shift is from 8 p.m. until the next day 9 a.m. But of course, because of our responsibility and people won't get sick at the timing you want. For example, they won't get sick that during your office hour. Sometimes it's very, very unlucky that maybe just 1 minute before you left the ward or 1 minute before you can able to just finish your work, then one patient actually get deterioration, mean actually have some emergency happen. So that is a time that we will work extra time. But because it's for human life, then we'll just proceed. So, and because we are actually still lack of manpower, hospital still a lot of workload. So usually, even though we state that the timetable is we start at 7 a.m., but a lot of my colleague and us actually come around 5 a.m. Then we go back around 7 p.m., something like that. But if you really like medicine, it's kind of like enjoyable and learn how to take care of yourself. I still say sleepless night. Of course, there is, especially your night shift. Then in this current issue, patient is like flush in non-stop. So uh, need to be afraid of. I would say if you love the job, it's still okay. Just like if you love to play game, then of course you can overnight play it. It doesn't be a big issue lah.
We want to talk about being a doctor at the end a bit more, but I want to know for a lot of students, because like they are all still in before foundation year, they're all in still SPM year and whatnot. What's it like for you back then in your SPM? Do you what kind of subject you have to pay attention to, and then what do you prepare and how do you prepare going into foundation and going into degree?
For going to my foundation, actually gone through my SPM. So for me, for what we told is because you want to become medicine, of course, your biology, your science field need to be good, and compulsorily to register. I'm not sure the university entry requirement, but to be registered as a doctor in Malaysia, you need to be at least credit for your Malay, at least credit for your sejarah. Triple B mean your mathematics, two science subject mean biochemistry, physics need to be at least B. So that is how I prepare myself before I join.
And presumably a lot of studying, late night studying, is it?
Yes.
Yeah, of course, especially during SBM, you want to make sure that you get the result for you to go into degree and foundation, right?
Yeah.
Okay, after that, when you're doing the foundation itself, at that time, what is going through your mind? Because you're preparing to be a doctor, what kind of skills that you need, or what kind of things that you need to learn before you go into a foundation, and why you decide to go into the college that you went into?
Mm, so for me, actually, the attracting thing about Segi is actually Segi do provide cadeva. I mean, basically what we call in a layman term, actually dead body lah. What we call silent teacher. So I think it's the only uni is actually provide me to have a pre-look of this and the environment friendly. But the one thing actually make me think twice, be very honest, to think about uh, to joining Segi is actually to be away from my family because the 3 year training is actually in Sarawak, Cebu. So it's actually quite far. Then I actually really don't want to uh, away from my family so far away lah that time. But however, after thinking and ask for my senior, actually, if you're willing to learn any place is good, especially for Cebu, even though it's a small town, everything well equipped, then the facility actually quite good, and the lecturer and the doctors here are actually very friendly. Throughout the time, actually, I was thinking of give up throughout my clinical years also. So at that time, actually those doctor passionate, and I see how every one of them actually do encourage us, tell us what is our difficulty, sharing, and all these things actually do encourage me to continue and bring me until the state I have now lah. And in terms of foundations preparation, I'm actually preparing for English because my mother tongue actually Mandarin. So as everyone know of, medicine actually full with English term, and those a lot of English term actually derive from Latin. So for you, for everyone of us, actually, we look at it, we don't even know how to pronounce it. So English, and second is social skill, and last but not least, I think will be other basic science because at the end of the day, a lot of things still go back to what we learn in the basic throughout our med school. I mean our SPM.
But Richard, tell me if I'm wrong. Tell me if I'm wrong. That back then when we think about medicine, you want to become a doctor. A lot of us think about, if you want to study medicine means you have to go to India, you have to go to Indonesia, this rural country because they have all the facility and whatnot. Is it true this day? Can you is it still possible to study everything locally in Malaysia like you did?
Yeah, it's absolutely possible to study everything in Malaysia. And actually, for me personally, I think even study in Malaysia will be okay. Of course, every country have their own benefit, but for me myself, if you want to practice in Malaysia, it's good that to study everything in Malaysia. Actually, Malaysia quite well equipped with all the instrument. Previously, during our maybe our old generation, we actually heard the rumors that because of Indian, all those things, they are well equipped so that actually doctors, I mean the medical student can go and touch a lot of things. Of course, that is true, but those facilities are already available in Malaysia. And the advantage in learning in Malaysia is language problem because a lot of them went to other country, so they need to learn another language, but and with English as the main language. But however, in Malaysia, because we are treating local people, we are not treating white people. So at the end, we still need to learn Malay. Even myself, come to Sarawak, continue my service, I still need to learn their own language here, which is Iban, to try to communicate with them because not everyone actually know English. So to be a Malaysian, I'm quite proud as I know multiple language, and this is actually a benefit for you if you want to continue your service in Malaysia.
Speaking of service, I want to know, maybe give the student a bit of insight as to your day-to-day life. If you have any pictures to show, or if you want to share, what are the things that you can share about your everyday life as a doctor or a trainee doctor?
I would say a lot of our picture is actually quite confidential, so it's not so suitable. Sorry about this.
No problem, no
Because
problem.
a lot of our patient and hospital design all those things. But to be a base-to-base life as a house officer, I would say, uh, we I usually wake up around 5 o'clock. So I go to hospital around 5:30 to 6. So the first thing what we do is actually to review the patient. What you mean by review is actually in the whole ward, we actually the hospital is designed to in such way. So you imagine is a lot of big room. So a lot of room inside got a lot of beds. So each bed have one patient. So they divide to discipline. For example, I'm now in medical posting. So that whole room will be equipped with medical patient. So every morning we go there. So those patients actually, because my hospital is still using handwritten system, not computer system. So the doctor will write the history about the bio data, what is the age, what is the problem of the patient, the blood investigation, what is the complaint of the patient on the paper. So what we do is actually we read this paper first. We know roughly what is going on to our patients, and review the patient what is currently now, because patient need a close monitoring. For example, middle of night he admitted, but however now it's already around maybe 5 o'clock a.m. So the thing might change. For example, 10 midnight maybe he have no chest pain, but now he have chest pain. So you need to assess how is the patient well-being. So we will assess this, document down as per medical legal issue, then examine the patient, how well is it, check through the medication. Is the medication given suitable for him or not? Is the urine output, is the bowel opening, any active complaint or not? Is it well or not? After that, around 8 o'clock, your superior, which is your specialist, and your medical officer, which is those trained doctor, will come to review the patient, together with you. This is a time there you try to tell them what is actually in your mind, just like daily discussion. So you discuss about what is happening to the patient, what is in your mind, how you want to go into treat the patient. If you are wrong, so that the doctor and the specialist will go and correct you and teach you the proper way. After that, those patients might sometimes, for example, let's say the lung problem one, might suddenly need some blood investigation. There's a time that we go and help to take blood investigations, go and request for some x-ray, or if they want to do operation, we will do pre-operation preparation. And according to the timetable, if you are selected to go to the operation theater, so we'll go to operation to help a surgeon to do the operations. And after that, they might have other issue. For example, let's say this patient actually come in for issue A, for example, having heart attack, but at the same time, unfortunately, during when you go to toilet, suddenly fall down, then having fracture over the leg. So because we are just medical department, so we need to go and discuss with other department, orthopedic department about this. Then at the same time, you can learn about that issue. So after all these things, we will go and discharge those fit patients, mean those patients already recover well. We will document now the summary of it. Then right now the continuous follow-up, because we won't let the patient go just like that. We will say at least when he want to take the blood, when he need to see us back, or any continuous care or not, to provide a persistent continuous care and optimal their help. So this is roughly how my daily basis lah as a house officer.
Then what have COVID-19 changed, or how have COVID-19 affected the daily life of a doctor?
It's actually affect quite a lot. So in very beginning of the strike of COVID to Malaysia, actually we do lock down a lot of service. For example, you will get the news, or if you ever have any family member who are actually unfortunate enough need to follow up in government hospital, they actually will tell you that you only can take the medication, or they will post you the medication to your house. So that is the time that we actually don't have a clear cut protocol what is going to do. Everyone actually in a mess. So that is the time we actually lock down all the service. We're not providing operation unless it's a really emergency. We're not seeing patient in the clinic. We only see really emergency. That time actually hospital just busy with COVID. So it's actually very miserable. And because to protect house officer, because we are still trainer, so that time actually only those well-trained senior doctor go and encounter them. But however, unfortunately, the case going up and up and up. So we do now is actually anywhere, everywhere. So we do start to be trained how to protect ourselves. So like I initially say, every patient come in, we will actually try to stratify them, just like the apps you actually recommend them to analyze how is their risk. So for example, they are actually very low risk. So we will just screen them. Everyone will put into the isolation room, mean only he himself in that room. Okay, until the COVID result is negative, only will pull out to general pool, mean mix with other patient. But however, if you are very high risk, or maybe your X-ray actually have some what we call lung changes, and if in that case, we actually will even repeat swab. Mean the first PCR may be negative, but however, because for example, unfortunately enough, for example, I'm the one who gets swabbed, then maybe my family actually is COVID positive. So by the day 10, I actually do need repeat another swab until both are negative, or what we actually consider you are very unlikely to have COVID, only we will let you to the general pool.
Oh, quite serious, huh?
Yeah.
But last, I want to ask a few last questions for a lot of students. First thing is, because like you say, a lot of things have changed and a lot of situations have become more difficult. Do you think, in your own opinion, do you think your university equipped you with the knowledge, or do you think that university helped you, teaching you all these things that actually help you go overcome all this problem?
Absolutely yes. So for us actually, in very beginning actually we already learn how to do this self protection. Mean, for example, wear mask, face shield, hand hygiene, all these things. But just because that time during my study time actually doesn't have COVID, so we do have those lecture and practical session before,
Mm,
and all these positive thinking knowledge actually do equip me well to for me to encounter this difficulty, especially in
mm.
this COVID pandemic.
Mm. I think then, because you are going through all this hardship, you're going through all this extra hour, all this extra effort. Do you think that at the end of the day, being a medical doctor, is it still rewarding enough? Is it still making enough money, or is it personally rewarding for a lot of doctors?
Uh, for me personally, I think it's totally rewarding to be a doctor. So it's not regarding about money. I think nowadays news so easy to get all those information. I
Mm,
think easily you search from Google, you can know around how much I earn.
mm,
So it's not that much. If I open a business, maybe I can earn even more. But the rewarding part is what when you see a patient from very ill until you recover. I still do remember one of the kids is actually having some born disease. Mean, for example, he is born to be like that. Mean he's born to be having muscle problem. The muscle actually will be from year to year it become very very small
mm,
until a day he actually will not be able to walk. So he is actually this actually a young boy is actually very very unacceptable because he's actually presented with suddenly cannot walk. So you imagine in your 5 years old, you're running football, playing football with your friends. So at that time, actually he come in and he's actually very very show his anger to every one of us. Then we're actually putting a lot of effort for him to cooperate with us, start to eat medication. Every time we pass the medication to him, he will throw to the rubbish
oh,
and just lie to us, say he eat. Then until after multiple counseling, talk to the family. The family actually also unacceptable. Why this is the first case in their family?
mm,
Why this can happen? So do a lot of thing happen to them already until the day he's actually much improved until he actually can walk with
mm,
minimum support. And there is a time he come to say thank you to me, say
mm,
he want to invite me to his house for a lunch and dinner. That is
mm.
fully rewarding. And at that moment, actually, no matter how much extra hour I work, how much I earn is really not important, but the thank you word for everything.
I guess helping people in itself, making people feel better, or making people improve their life in terms of health itself, is a reward for a lot of people. It's very rewarding to see people change or become healthy, right? But
Yes.
okay, as a closure, if you have anything else to share, but as a closure, I want you to maybe give a few words of encouragement or motivation for a lot of wannabe students or wannabe medical field students that is sitting with us today.
Mm, so for myself, of course, some of my word might be sound a bit scary, discouraging for all of you, but trust me, even those with those scary things, you see every year still got a lot of doctors. So just like Maven say, helping people, seeing people improving in their health is very, very rewarding.
Mm,
So all these things actually, if you are passionate enough, if you really thinking of want to help people and you have the passion and want to become a doctor, you love hands-on skill, you love to talk with patient. There is actually multiple departments. You don't like adult, you can go to kids. You don't like guys, maybe you say I hate guys, you can go to take care of only women, take care of their obstetric, only pregnant women and women health only. So a lot of things, if you really really love it and you really want to become a doctor, just don't be afraid, try hard. If you are passionate enough, all these things is easily to be overcome. and you will be enjoying it.
All right. Because being a doctor itself, it is a very hands-on work, like you mentioned. So for a lot of students, maybe they want another option. They are interested in medical field. They're interested in bioscience, in chemistry, but then they are not necessary. They don't really have the necessary interest in maybe hands-on in physically helping people. This is where I think the next speaker would be really inspiring for a lot of students here. We all know that aside from being a doctor, another way to help people is actually doing research, doing testings and all that kind of stuff, making new medicines, because that is the other aspect of healing a person. So I have a very interesting speaker here. Her name is Serum Wee. She's a researcher in biomedical field. I want her to maybe give us an insight into the other world of medical science. Here we have Miss Serene here. Serene, would you take the stage from me?
All right, thank you, Mervin. So I'd like to share my slides.
Again, student, if you have any other question at all, please feel free to ask, because at the end, you are deciding your future. You want to decide whether, hey, you want to be a medical doctor or you want to be a researcher kind of career. So you need to decide, you need to know how different the career are. So here is where you can ask those questions. Yeah. So feel free to ask a question. Serene.
All right. Thank you. So a very good afternoon. I greet to all of you. So my name is Serene Wee, an alumna from Segi University. So today I would like to have a very small session with all of you on career sharing. So this will be a few sections that I would like to cover for today. So first will be experiences in Segi, introduction to my workplace, my department, and as well as some challenges which I faced during my work life. So first, my experiences in Segi. So I spent a total of 5 years in Segi. So at first, I took foundation in science. I graduated back in 2015. And later, I took up degree in Bachelor of Biomedical Sciences. I just graduated last year. So for these 5 years in Segi, what do I enjoy the most? First, of course, is meeting new friends. And second, it's also I enjoy doing practical work, which is conducted. So I enjoy doing lab work with my classmates. So it also helps to foretaste how it will be like working in a lab in the future. So besides that, it also equips us with a basic skills of lab. So moving on, I also am doing my research. So as you can see from your left-hand side, it is a symposium which I've participated, hosted by my juniors. So I really had a great experience. And on the right-hand side is the completion of my thesis back in 2019. So I am really grateful for my mentor or supervisor for helping me completing my thesis on time. So moving on, I also enjoy my clinical placement, so which is included in my course. So there are a total of 2 placements. So first, it is a short placement, lasted for 6 weeks, and another one is a long placement, lasted for 16 weeks. So my short placement, I did it in HU Camp Cheras, while for the long placement, I did it in my hometown, which is Kuching, Sarawak. So the hospital that I went to is Borneo Medical Center. So basically, I really had a very great and valuable experience in Segi for 5 years. So coming into the main part of my sharing session is that I would like to introduce to you to my current career. So this is my workplace. So it is known as Sarawak General Hospital. It is actually a government hospital. So I have been working here for around 1 year. So initially I was employed as a medical lab technologist, but around March this year, they have promoted me to be a scientific officer.
Ooh,
so this is the department. Yeah.
Sounds so cool.
Okay, so thanks. So this is the current department which I'm working in now. So it's known as Blood Bank Department. So Blood Bank Department is actually, we are dealing with blood donors. So you can see that this is a picture of a donor donating his blood. And on the right-hand side, it is the nurse arranging donor blood bags. So in blood bank department, it has been divided into many different labs. So the main lab that I am working in now is Transfusion Microbiology Lab. In short, we call it as TML. There are a total of 9 staffs. So there are 2 MLTs and 7 scientific officers, including me. So this lab, the main purpose is actually to screen the donor's blood in order to reduce the transfusion-transmitted infection, as well as to provide safe blood to recipients as well as patients. So in TML, it is further divided into 2 labs. We have serology lab and also NetLab. So this is how our serology lab looks like. So the main purpose of this lab is actually to screen the donor's blood using 3 markers, which is HIV, HBV, and HCV. So we also test the blood sample for syphilis, and we also run for antibody tests, which includes hepatitis B surface and hepatitis B core, which is upon request by medical officers or medical doctors. Besides that, we also do confirmation tests, including HIV-PA, neutralization, as well as TPPA. So besides that, we also outsource HIV and hepatitis C reactive samples to PDNKL for immunoblotting tests. So these are some of the examples of blood donor samples, which is collected in plant tubes. So we will run these plant tubes in the analyzer. So this is the main analyzer used in serology lab, known as Architect. So this is syphilis test, which we will do it manually. So as you can see from the first photo, it is a control that we will run every day along with the donor blood samples, which is shown in photo 2. So moving on, this is some of the examples of screening test result, which is generated from the analyzer Architect. So as you can see from your left-hand side, so each of the donor sample will be screened with hepatitis C, hepatitis B, as well as HIV. So on your right-hand side, it is the syphilis test result, which we will do it manually. So moving on for antibody hepatitis B surface and hepatitis B core. So as you can see from here, there's a range here which you can refer it to in order to indicate whether the result is reactive or non-reactive. So moving on to confirmation tests. So on your left-hand side is TPPA test. So this test, it is actually a confirmation test for syphilis. So when the donor sample tested reactive for syphilis, then we will proceed with TPPA test. Then on your right-hand side, HIV-PA. So tested for donor sample, which is found to be reactive in HIV. So the one that I circled in red here indicates that the donor sample is reactive in HIV. So moving on to neutralization test. So this test is actually a confirmation test for hepatitis B virus. So it is run by the analyzer Architect, and on your right-hand side will be the lab test report for neutralization. So this is some of the example of reactive blood bags. So when the donor is tested positive in either one of the infection or virus, then we will request the inventory to discard the blood bags.
Oh,
so as I've mentioned,
the infected blood.
yes, correct. Okay, so as I've mentioned earlier, for hepatitis C and also HIV reactive sample, we will send to PDNKL. So what we do here is we will aliquot the samples, either plasma or platelets, into 2 plant tubes, and then we will send it to KL. So moving on, we also archive reactive samples. So whatever reactive samples we will archive in this cryogenic valve. So it is approximately 5 mils. Then we will store it in the freezer for up to 5 to 10 years.
Oof.
So moving on to Serum Convert. Serum Convert is where initially the donor is tested negative for all infection and virus, but unfortunately, after a few months or after a few years, they come back for donation and they were found to be positive in either one of the infection or virus. So for this kind of case, we will file it and document it. So what we do here is first we will fill in this Serum Convert form and we will pass it to the medical doctor in charge. So the medical doctor will do further investigation and they will also call the donor to come back to the hospital for counseling. So moving on to NetLab. So this lab is actually quite new because we start operating this lab around March this year. So NetLab is divided into two sections. So we have preparation area is where you prepare the donor samples. And second section will be testing or processing area. This is where we process the donor samples. So why is NetLab important? Because it is highly specific and sensitive for viral nucleic acids. It helps to amplify the targeted regions of viral RNA and DNA. So what is the advantage of NetLab? It helps to detect infection earlier than any other screening methods, and it also shortens the window period of HIV, hepatitis B, and hepatitis C infection. So the donor blood sample will be collected in this tube known as K2 EDTA tube. Then we will run the samples in this analyzer known as Panther. So this is some of the example of the screening result from Panther. So as you can see from here, we will run internal QC as well as external QC together with donor samples every day. So we process all donated samples from whole Sarawak, including Sibu, Bintulu, Miri, and also other small districts in Kuching. Once in a month, we will run this discriminatory test for samples which are reactive in both serology and NET testing. So here are some examples of the reactive sample which we have accumulated. So discriminatory test is actually a test where we would like to identify the specific viral nucleic acid which is found to be present in the donor's sample. So for this test, what we do, we will need to file it and document it. So as you can see from this first example here, so we will record down the blood bag number and record down the serology test result as well as NET screening result. So as you can see from the first example here, the donor is tested to be reactive in hepatitis C virus. So this is the example of screening result for discrete hepatitis C, discrete HIV, as well as discrete hepatitis B. So basically, these are some very short and brief introduction regarding my daily work routine, as well as the tasks which I carry out in my workplace. So now I would like to touch a bit on some challenges which I face along my work life. So first, it will be communication and work. So as we know that without communication, impossible we will have a great teamwork. Therefore, we need to be equipped with the basic skills of communication. As we know that once we are out working, we will need to deal with different people as well as we need to work with different people. So we need to have at least the basic skills of communication in order to have a great teamwork. So second will be accuracy and attentive. So as I've mentioned earlier, the main purpose of my lab is actually to provide safe blood to patients and recipients. Therefore, we need to be very accurate and be very careful while conducting any tests. Because if any mistakes are done, we will actually put the patient's or recipient's life at risk, which we do not want that. So it's best if we could make zero mistakes if possible. And lastly will be resilience. So resilience is where we need to have an ability to overcome hardships and also the ability to adapt to any changes in work environment as well as workflow. So I guess that's all from me.
Thank you very much for the presentations. But we have a lot of questions to ask because I think mainly because is that a lot of students when they think about medical field, the first thing they think about is being a doctor. Being doctor is everything, this kind of thing. But then they always forget what about those people that handles like you mentioned, blood pack or blood bag, this kind of thing, or even I don't know, syringes and other vials of scientific biology thing. There's a lot of those kind of thing in hospital that people don't usually
Yeah,
think about. So what are the what are the most important thing in your duty that you think that actually helps people instead? Because we can see that you're doing all these tests. What are they actually for in a layman term?
Okay, as I've mentioned earlier, the purpose of FrontLab is actually to provide safe blood to patient and also recipient. So what we do here, we deal with blood donors. So it's very important that we screen the the donor's blood. So we need to, because the blood will be used for patient as well as other recipients. So if there's any virus or infection, if we do not screen it properly and we just transfuse it to patients or recipients, then we might cause their life to be at risk. So therefore, it's very important. So I guess our main role is actually to ensure that whatever blood we provide, it's safe for recipient and also patient. Yeah.
Are there many topics different in biomedical topics that a person can choose? Let's say now you are focusing on blood and making sure blood are clear and clean from any other diseases and whatnot. What other field are there?
What other field? You mean as in what other we can do, is it?
Yeah. What other opportunities that you have? Because now you're testing blood. Maybe some other biomedics may be dealing with, I don't know, virology. Are there these kind of things?
Yes, we have microbiology and also cytology, pathology. I think the most interesting one will be cytopathology. I did my internship in Biomedical Center. So it's where cytopathology is where we can deal with different fluid, and also histopathology where we deal with different organs and cell, which is very interesting. I think you get to see like human organs, and we will need to test the organs, test the samples of the organ to look for any diseases, and also that's it.
That's it. Okay. But we see that you are doing a lot of tests. And I'm just wondering, what are the things that when you're doing tests, what are things that keep you going? Because to a lot of students, this might be a very tedious or very tiring work. What are the things that interest you when you are doing all this kind of work?
Interests me. Once you know that you are saving someone's life, then it's very that will keep you going. Yeah.
Well, that's very true as well, because I think a lot of students they just see it as I'm doing with this chemical, and then this blood, but then they don't think about the level of impact that they might have when they are doing the work that you are doing. Because at the end of the day, the things that you're doing, for example, the blood, are going into a healthy person or going into a person patient at the end of the day, right?
Yeah.
Okay.
So we are actually count as hero because saving people's life. Yeah, you feel like wow.
That's very true. Well, because their hero come in different capes. They are the ones that literally helping people in front of them, and they are the ones that helping another person that is helping another person, which is what you are doing, right, Serene?
Yes, correct.
What have the COVID-19 changed your career or your job, your profession as a whole?
Actually, it does not really affect, because me, I'm dealing with a donor instead of patients. So I'm actually quite safe, just that our blood bank, the storage of our blood has been decreased due to the pandemic. Because of the pandemic, so most of the donors, they are afraid to come forward to donate their blood due to the pandemic. So we actually did this advertising. So we will we keep on advertise on our Facebook and on our page to tell people that it's really quite safe because we are following all SOPs and also wearing full PPE. So so the advertising actually helped. So the blood donor actually came back, and the storage of the blood also start increasing. Yeah.
If a student were to tell you, hey, I'm deciding between studying a doctor versus a biomedical field, they are in between the line between these two. What would you tell them if you were to ask them to study biomedical field? What would you tell them instead?
Both is great. Because both are saving lives. It's just that becoming a doctor, it's like for me, I don't know what others think, but from my point of view is that doctors will be quite more stressful life. And as a medical lab technologist, because it's more, your time will be more flexible. You'll have more of your own time, not that stressful. And you do not need to deal with patients. That's one of the things, because some patients sometimes it will be very fussy, and you like, sometimes you also don't know how do you deal with the patient. So if you are not good in dealing with patient and you do not really have the passion, so I would say like you can choose to go for biomedical science.
So basically, I think will be very different for different people with different characteristics. Basically,
yes.
So some certain people, they like hands-on stuff. They like to meet the person in real life. They're a bit more extroverted, so they like to help people in front of them and like to meet different people in everyday life. But whereas if you are introverts like me, well, I'm an introvert, where you will prefer not to see as many people, or just want to be, or just enjoy the work of going through information in a more detailed manner. If you're that kind of person, then this is a more career. This career is more suitable for you. Am I describing right for you, Serene?
Yes, correct. Yeah.
Because at the end of the day, you don't need to meet that many people. Because I don't know, but for me as an introvert, meeting people is sometimes can be a bit scary. People are very unpredictable. Sometimes, especially like a doctor, doctors are putting themselves. They are hero because they're putting themselves in at a very risky position, because a lot of time patient might not reveal certain disease in front of you, and then until it's too late. But then for medical field, for lab field, it's a bit more predictable. You are more protected in a way. You are isolated, but it doesn't mean that you are not as much as a hero as a doctor. It's just that different ways of helping people. Some people risk tolerance are higher, some people risk tolerance are lower. Okay, but anyways, was the study difficult? What are the subjects difficult?
Yes. For me, I think the most difficult subject was chemistry, organic chemistry.
If a student is interested in your field, what are the subjects they should look for? They should maybe emphasize in or pay attention to in SPM and also in foundation year. Is maths really important? Is maths really that important at the end of the day?
Because instead of SPM, I took all levels. Yeah, so I did not take up at maths. And maths, I'm not quite sure about the entry requirement because I can't recall. But then what's important will be what Dr. Richard have mentioned just now, your science subject, the major subjects like bio, physics, chemistry, although I don't like chemistry. Yeah. Yeah, I think that, yeah.
Because just now Richard mentioned Segi provide them a cadaver, meaning a dead body for them to do autopsy on. What is your practical experience like in Segi? What are the things that they provide you for you to get more hands-on?
Actually, we did quite a lot, like microbes, and also deal with blood. Yeah, actually quite a lot. Can't recall, but I really enjoy all the practical work now. It's a very great experience because it really like equip us with the basic knowledge and also the skills working inside the lab. Yeah.
What about career progression in your line of work? Because now we just now heard that you are being promoted into a lab officer,
Yeah.
a scientific officer. Sorry. What
Yeah.
other titles or what other career path can student look forward to? If let's say if they want to become a lab officer like you, but then they want to know, hey, there's a ladder that I can climb. Are there such thing like that?
If you took a diploma, if you take diploma, then you will stop in the stage where you'll be just medical lab technologist. So if you go further, for example, degree in Bachelor of Biomedical Sciences, then there will be much more chances for you lah. You can get a scientific officer job, you can be a researcher, and you also can take part in cells like biomedical devices.
I think a lot of students gotten their kind of insight as to difference between a biomed student and also a doctor. Being a doctor, like I mentioned just now, you need a lot of hands-on. You need to be able to be a legitimate hero. You need to be in front of people, helping them, knowing the risk, but still helping them at the end of the day. Because, yeah, like I say, you are putting yourself in a very fatal position sometimes. So there's a very high courage requirement for you to be a doctor at the end of the day. But if you are the person that maybe more like me, a bit more good and maybe a bit more introverted, you can still help people, but you help people in a more indirect way. You help people by being the person that help another person, which are doctor that administers all these. Like example, what we have here is Serene, helping them to make sure the blood that are going into people are clean and healthy and free of other diseases. But all this cannot happen without the proper education. Cannot happen without the proper experience. So we want to hear a bit more from Segi University themselves. Here we have Miss KK.
So basically, I believe most of you from maybe like SPM, IG, international school, or maybe currently attending a UEC soon. Okay, all these are eligible to join MBBS course or BBMS course. Okay, but of course, the first requirement basically is you must be from science stream. Either if let's say you're going for MBBS, you must be from pure science stream. All right. So first, I'm talking about MBBS first. Okay. Basically, MBBS and BBMS, what is the difference? I believe that just now Dr. Richard and Serene are well explained on the difference already. So in terms of the requirement, there is a little bit difference as well. All right. So if let's say for SPM student, remember you must have 5B for MBBS. 5B must in 3 science subject, which is biochemistry, physics, max or MX, and then the last subject, any subject like BM, BI, BC is up to you. As long as you got 5B, the 4B must be in science, 3 science subject and 1 max subject. All right, same to international school student. Okay, same to international school student. So if let's say you are for BBMS student, okay, you must have at least any 5 credits, which is 2 credit in science, 1 credit in maths, and another 2 credits in any other subject. Then only you will go to foundation in science. Then after that, MBBS or BBMS. BBMS is a short form of biomedical science. All right. So same to the IGSE student. So IGSE student, I think it's Serene's coming in already.
Serene, we are going through a bit of the marketing information a bit, but before that,
Okay. Sorry.
I want to let KK finish it. If you have any other things that you want to add on, maybe I'll invite you at the end of the session to add on a bit. So KK, you can continue.
Right. No problem. Okay, so after that will be for international school, same 5 credits as well. So 5 credits is actually 3 science subject, 1 math subject, and another subject. Okay, all right. So basically, what is the difference SPM and international school? Basically, it's actually on the BM, because for MBBS student, the exit requirement before you register with the MMC, you must have SPM BM in credit. You must have before you register with the MMC. So for SPM student, definitely not an issue lah. If let's say you're getting a D, then you need to receipt no. But if let's say for IGSE student, no matter how, you need to go for SPM BM. All right. So for UEC student, basically, if you let's say for MBBS actually for UEC students similar as STPM or A level, if let's say they're qualified. So how to justify they're qualified or not? So after the UEC, they must have B4, not B5 or B6, B4 in 3 science subject, same biochemistry, physics, max or MX, and any other subject. Okay, so for UEC student, remember, must have B4. If let's say you got B5 in max or B5 in physics, but the rest is B4, sorry, you must resit or you must redo your foundation. Okay, so the entry requirement is actually kind of straightforward lah. So basically, you must have the science subject. So you must kind of strong in science subject. But for BBMS student, you don't need for 3 science subject. As long as you got 2 science subject, then after that, you're able to join for foundation. We will refer your foundation result only. So your foundation result, CGPA 2.33 and above, then you can join to BBMS, means the degree program. We will not look at the SPM or IGSE result again.
Okay, what about the campus location? Because a lot of students now, they might be everywhere, they might from other states. So what are the campus location at?
All right, our campus location is actually in nearby to 1U, Bandar Utama, which is located in Selangor, PJ, Petaling Jaya. So we are in Petaling Jaya state of Selangor, of course, then Kota Damansara. So we are beside the MRT station. All right. So if let's say you guys are from Klang-Mary, I believe you guys know where is Kota Damansara. Or you don't know Kota Damansara, no, never mind. You know where is the curve. You know where is IKEA. You know where is 1U. So we are nearby that area. So basically, we are actually in the center of city. So you don't need to worry, oh, is it very far from the restaurant? Is it very hard to look for the food? Or is it not convenient for transport? From here, transport is very, very convenient because we have public transport just beside of the campus. All right. And then food, of course, we are in the middle, in the center of the city. Definitely, you can get whatever you want.
It's wonderful.
Yeah. So it's very convenient, I will say super convenient. You just you don't need to worry about food. You worry about enough money or not.
Yeah, just like Dr. Vichep mentioned that some students have to go to abroad to finish their medical studies to become a doctor. What about the arrangement from Segi College, so Segi University?
Okay, you mean like the arrangement is in
terms of do they if I'm a student there, I want to study until finish being a doctor, can I just stay in Malaysia until finish, because I don't want to leave my parents, I don't want to leave my family. I just want to study in Malaysia. Is it possible?
Yes, definitely. You don't need to go overseas, okay? But for MBBS student, maybe if let's say you are from Klang-Mary student, maybe you need to leave your family for 3 years because your clinical year will be in Sibu Hospital, which is located in Sarawak. Why we choose Sibu Hospital is because Sibu Hospital exclusively for our Segi student only. Exclusively. What is exclusive? Means the Sibu Hospital only having our student. All right, instead of sharing with other university. So you guys can just survey around. So most of the university are sharing. Okay, so one of the patients sharing or this A university asks, oh, how about you? How is your today? Then later on, after 1 hour, then another university come again, ask the same question. So this is actually not good for the patient and student, to be honest.
Can
So
we talk about the amenities that you guys provide? Because just now we hear from Serene, and also hear from Dr. Richard that, hey, you guys provide like cadaver and lab experiment and practical stuff like that. What other things will student experience through your courses?
okay, yeah, definitely. If let's say, the best thing, if let's say for MBBS, the first 2 years you will be in our main campus. Okay, the best thing is actually we have 3 dead body, means the cadaver. Okay, the the cadaver is for student to explore. Means because you are MBBS student, so definitely you need a real body to explore. All right, because some of the student I might asking me, hey KK, that which student, which college, they have a digital board
Cadaver.
to explore on the disease. Then I ask them, why you need the digital board when you are learning?
Yeah.
Did the government school provide you this kind of digital board or not?
Yeah.
So it's very important for student for hands-on skill, and then learn from the basic first. So in future, if let's say the government hospital really come in for the digital board to explore, I mean to discover on the disease, then okay, then you learn from there.
Mm-hmm.
But you learn from the high tech, and then how you go again for the basic.
Mm-mm.
It's
And,
very hard.
and
It's very
also,
hard.
because we know COVID situation, the pandemic has changed the medical field quite a lot. Like just now, both of our speakers just now also mentioned that there are changes, some more significant, some lesser significant, but there are changes to their career. How
Correct.
well does Segi University prepare students for all these upcoming changes?
All right. So first of all, because right now, for MBBS student, they'll be doing in Cebu Hospital. So in Cebu Hospital, actually, our students are involving in the for the injection right now. So basically,
The
for our
vaccination, is it?
yeah, correct. So sorry. So basically, they are involving in the vaccination, and then we have the clinic. Okay. So basically, the students are quite up to date lah, in that sense that they are quite up to date. And then we will teach them about like not to like afraid of the just like what Dr. Richard say, not to afraid of the virus. Okay, you must know how to deal with the virus. All right. So for MBBMS students, same. We actually having our own so-called, if you ask the student to do the swab test also. All right. I mean to learn how to do the swab test, everything, the testing, everything. So it's actually more to like close to what happenings right now.
And I'm sure your lecturers and your staff are all educated in terms of updated in terms of the new development in terms of this pandemic, right? Because they have to do
Definitely,
their ongoing research and all that. So I think
definitely.
students are really in good hands in Segi University, isn't it?
Correct. We are actually more focused in the practical and then hand-on skill, lah, to be honest. Otherwise, why we choose Cebu Hospital? We are not purposely sending our student to Cebu Hospital just because of for the accommodation or maybe the fees or whatever. We purposely send our student to the Cebu Hospital. First thing is because of the practical, because you are not sharing with others university. So your hands-on skill are stronger than others.
All right.
So to be honest, like Dr. Richard, I believe this point he is most agreeable, because most of our student is actually very light on the lifestyle in Cebu Hospital. So because of the hands-on skill. So I would say our student hands-on skill are stronger than others.
All right. Then before we end today's sessions, I want you, Ms. KK, to maybe give students that are interested in this field, either being a doctor or being a science officer, this kind of thing, biomedical field. What are the things that you can tell them if they are deciding between these two?
All right. If deciding between BBMS and MBBS, so how you decide? So if let's say put aside on the financial part first. Put aside the financial part, okay? If you have the passion on how to treat people, okay, you go ahead for MBBS. You go ahead for MBBS, even though it's quite tough. I would say it's quite tough than BBMS, but you get the
Reward.
the reward, and also is better than BBMS. But if let's say you are kind of introvert, like what Sarin said just now, you are kind of introvert, then you go for BBMS because MBBS you must know how to talk, how you communicate with patient, how you communicate with parents, or how you communicate with the family. Okay, so and also it's kinda the responsibility are much more big, I would say.
At the end, they are
Bigger.
both big also because they are both saving people. What?
Correct. But for BBMS, well, BBMS because they are inside the lab, so they are not meeting with people actually.
Before I teach students how to find out if they have the passion for either of this subject, may any last word for why they should choose Segi University?
Why you need to choose Segi University? First thing for MBBS because from our practical part, our clinical year. This I would say is the best thing from us. Our clinical year are stronger than others because
I agree.
as a student, as a doctor, what you want is in the future you are treating a real human. So you are not like, oh, after when I houseman only I learn how to work. When you are in third year clinical year, you must already adapt into the environment. You must adapt to the culture. Oh, I already is a doctor right now, even though I'm learning. So when you're going for houseman, you are not afraid. You are not, now what I need to do or what. So the culture, the mood is very, very different. So for BBMS student, I would say if you are in kind of introvert, then you like chemistry and you like for the bio, then you can go ahead for biomedical science. Because for MBBS student, you need to have physics. Why you need to have physics? Those like X-ray, you need the physics also. So if let's say your physics is not strong and you are not interested to become a doctor, to be honest, go ahead for BBMS because is under the same faculty of medicine. Basically, the first year, they will have quite many common subjects.